Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I will be treating the gross anatomy of the adductor canal, which can be called the Hunter's canal or the subsartorial canal. It's a very, very important canal on the thigh region. Let's dive into the class proper. Okay. First thing to note is the introduction of the adductor canal. What is adductor canal? Adductor canal is an intermuscular tunnel or a fibromuscular tunnel that is situated on the medial side of the middle one third of the thigh. That is the introduction of the Hunter's canal. It is a muscular tunnel or a fibromuscular tunnel. It means that the tunnel is being surrounded by a band of muscles. That is why it's called an intermuscular tunnel or a fibromuscular tunnel that is situated on the medial side of the middle one third of the thigh. That is the concept. So I'm going to be giving a little bit diagram illustrating how this tunnel is from the scarpus triangle, that is the femoral triangle, down to the popliteal fossa. Okay, this is how it goes. Here is the scarpus triangle. It goes this way. Here is the popliteal fossa. Okay, as you can see that this is the femoral triangle, which can be called the scarpus triangle. The scarpus triangle. Here comes the adductor canal. Right here becomes the adductor hiatus. This is our popliteal fossa. As you can see that the essence of this adductor canal is to allow passage of femoral vessel that causes way downward from the femoral triangle down to the popliteal fossa. And what are those important femoral vessels? We have the femoral artery and the femoral vein. To look at the adductor canal, that is it. So the next in line that we'll be looking onto is we have the shape of adductor canal. Adductor canal is conical or pyramidal in shape, but when seen or when viewed in a cross section, it is triangular in shape. That is, when you view it in a cross section, you call that it is triangular in shape. So it is conical or pyramidal in shape, but when viewed in a cross section, it is triangular in shape. So up the next is the extent. The extent. What is the extent of this adductor canal? Adductor canal extends from the apex of the scarpus triangle, that is the femoral triangle above, and to the tendinous tunnel of the adductor magnus below. That is the extent of it. It extends from apex of femoral triangle above and tendinous tunnel of adductor magnus below. So these are the extent of the adductor canal. So up the next we're looking on to is what we call the boundaries of the adductor canal. The boundaries What are those boundaries that is associated with the adductor canal? Those boundaries includes one, we have the first boundary is the anterolateral boundary. Anterolateral boundary. The second boundary is the posterior boundary or the floor of the adductor canal. Posterior or the floor. The number three boundary is the medial boundary or the roof. The medial boundary or the roof. Okay. The adductor canal is bounded anterolaterally by the vastus medialis. That means the vastus medialis forms the anterolateral boundary of the adductor canal. And these are the boundaries of the adductor canal. So this diagram depicts the boundaries of adductor canal. The boundaries. So it is bounded anterolaterally by the vastus medialis. So way up here is the vastus medialis. Is bounded posteriorly by the adductor longus above and the adductor magnus below. And the posterior boundary is as well the floor of the adductor canal. So way down here is the adductor longus. Okay, let's go into the next boundary, which is the medial boundary, known as the roof of the adductor canal. Adductor canal is bounded medially by a strong fibrous membrane that stretches across the anterolateral and posterior boundary. And what is that strong fibrous membrane? As you can see it here, look at this. Look at the strong fibrous membrane. It stretches across the anterolateral boundary and the posterior boundary. So it is a strong fibrous membrane that stretches across the anterolateral boundary and the posterior boundary. Important to note, the sartorius muscle, which is the talus muscle, is as well the muscle that has the longest tendon in the human body, overlaps the roof of the adductor canal. Look at the sartorius muscle here. What does it do? It overlaps the roof of the adductor canal. Sartorius muscle. Important to note again, the substatorial places of nerves lies on the roof underneath the sartorius muscle. And here are those substatorial places of nerves. We call it substatorial places of nerves. Substatorial places of nerves. What are the branches that is being given off from these places? We have the medial cutaneous nerve of the thigh, the anterior division of the obturator nerve, and the saphenous nerve. Those are the branches that arises from these places. They're important places in the thigh region. Okay, we are done from the boundaries of the adductor canal, which can be called the hunter's canal. Up the next is the contents. Contents. What are the contents of the adductor canal? This diagram denotes the contents of the adductor canal. The number one content is the femoral artery. Femoral artery. The next is the femoral vein. Femoral vein. The next is the nerve to vastus medialis. Nerve to vastus medialis. We have the saphenous nerve arising from the substatorial places of nerve. saphenous nerve. Okay, another content of this adductor canal includes the descending genicular artery. You have the descending genicular artery. The genicular artery or the descending genicular artery gives us a branch which is the saphenous artery. You have the saphenous artery, saphenous artery. So these are up here. We have the anterior and posterior division of the obturator nerve. Anterior and posterior division of obturator nerve. Anterior and posterior division of the obturator nerve. So these are the contents of it. So we have here the femoral artery, femoral vein, nerve to vastus medialis, the saphenous nerve. So these are the contents of it. So let's finish our labeling from these boundaries. What we have here, this here is the femoral vein. Here, the femoral artery. Here is the femur. The femur. Why this nerve here is the nerve to vastus medialis. The nerve to vastus medialis. Nerve to vastus medialis. Okay, this becomes the saphenous nerve. The saphenous nerve. Up to the next is the clinical correlation or the clinical and applied anatomy. What are those clinical correlations that is related to the adductor canal? Number one is popliteal aneurysm or the aneurysm of the popliteal artery. In the aneurysm of the popliteal artery, the femoral artery is exposed and ligated at the adductor canal. And that surgery was first performed by a famous surgeon known as the Dr. John Hunter. That is why this canal can be called the Hunter's canal. Popliteal aneurysm. The second one is the adductor canal nerve block. We call it the adductor canal nerve block. Adductor canal nerve block. This is administered as an anesthesia during surgery at that region in order to numb the nerves which could be transmitting pain sensation. So the patient will not be feeling pain while conducting surgery at that region. So it is called adductor canal nerve block. So the next one is popliteal aneurysm. The popliteal varicose. Popliteal varicose. This is secondary to popliteal aneurysm. So on popliteal varicose, it could as well be assessed on the adductor canal. So that is the clinical correlation that is related to the Hunter's canal which can be called the adductor's canal. Recall that this aneurysm simply means abnormal dilations of the blood vessel wall. That is what it means. So it is the dilation of the popliteal artery. That is, we call it the popliteal artery aneurysm. So I believe we have done justice to the adductor's canal. We have explained every detail in this canal. I believe you enjoyed the class. Endeavor to share and subscribe to this channel for more videos on the anatomy. Thank you so much for watching.